Welcome to another episode of COVID-19 Conversations, where I speak to people from all walks of life from all over the world about COVID-19. Their views, their expertise, their experiences, and also about how COVID-19 has been impacting their lives. And today I have a very special guest, Dr. Leong Hoe Nam, infectious disease specialist from Singapore. And he's a very eminent figure in Singapore's fight against COVID-19. So welcome, Dr. Leong.
You're too kind. You're too kind. I don't think I'm eminent. If anything, all of us are just trying our very best in COVID-19 control.
Let's start the review, Dr. Leong. How has COVID-19, the pandemic, since it started early this year, how has it impacted you? In every sense of the word, personally, professionally, how has it impacted you?
It's impacted me tremendously. I'm an infectious disease physician, so my first line and what we're trained to do is actually on COVID-19. Outbreak, investigations, new patients with fever. This is what we have all been trained for. Yep. In fact, we also learn about epidemiology, we learn about the spread, and all this is basically the crux, the very soul, the very DNA of infectious diseases. Yes. For that, I'm happy to be able to do this, but it is honestly very, very tiring. It's tiring for the individual because every single patient, we're dealing with a disease we don't know of, with very little experience. We have to sort them out. So it's really challenging. Every single patient, we have to put on the gown, the mask, and treat each patient as a potential case. Because if we make a mistake, we actually send a person who's infected with COVID-19 out to the community or into the wards and sabotaging the whole hospital. So the burden on our shoulders are extremely heavy. Number three, we also realize that many doctors are paranoid about this condition, and they will often refer to us and ask us to sort it out. Yep. So again, the burden is on our shoulders. It is tiring. Okay. Socially, and I think all of us are aware, we are under this circuit breaker mode in Singapore, or it is a lockdown situation in many countries. Yep. We're dealing with the restraint in going out. We can't go out. We can't have our usual fix, our usual coffees, our usual drinks, our usual hangouts. Even the regular exercise out is restrained and controlled. So we are not only fighting a viral infection, we are not only fighting fear, the fear of the epidemic and the fake news, but we're also fighting the psychological impact this virus is hitting on all of us. So
including doctors or colleagues,
Absolutely. The psychology of fear, the psychology of the illness, the psychology of being locked up inside, and of course, our own disease management. In diabetes, for example, we're supposed to exercise, but now we can't exercise. In fact, if you exercise, you may end up with infections. So this is really, it really upended our way of life. The way of life which we are familiar with is completely gone topsy-turvy.
Just like you rightly put, this is what infectious disease physicians like you, are trained for. This is what you're trained for. But yet at the same time, it is very stressful, not just for you, but for everybody. But has things changed? At the beginning of this pandemic, we are fighting a novel virus, a new disease, right? But it has been a few months now, and we know a little bit more about this enemy than before, right? I'm sure right now, things are coming together, right? We are still a very long way from winning this battle against COVID-19, but certainly we are now know what weapons to use a little bit more than at the beginning of this crisis, yeah?
Yes, absolutely. So things have changed. From an unknown virus, we begin to know a lot more, know a lot more patterns. And doctors and human beings, we try to associate it with what we have learned in the past. We say it looks like SARS virus, it behaves like SARS virus, but then no, it's not quite. It behaves like flu viruses, but then not quite. In fact, this virus is new, is unique. It is uniquely COVID-19. It is special on its own, and it's its own behavior. So the way we appreciate viral infections guess what? COVID-19 makes us think otherwise.
Yep.
I think we have never encountered anything as remarkable and as so unique as COVID-19. And for that, I think it caught the whole world unaware.
I think it's a double-edged thing. Right? I know I don't have the time to go into your story with SARS in 2003. I was also very involved in SARS in 2003. Right? Of course, that in a way helped us to be a little bit more prepared, right, this time around. But yet, on the other hand, it has put us, in the wrong frame of mind if we think of this COVID-19 as SARS, because it's similar but yet very different. Right? I think it hampered to some extent the beginning of what we did, because I think we were taking main reference point from SARS, right? But increasingly we learned that this is very different from SARS.
Absolutely. We use SARS as an example, and that way it helps to communicate to the rest of the public, and it provides a method of control within the hospitals. For one, SARS, we only look for them when they have fever, when they have symptoms, and it worked beautifully. And SARS spread only after the first 7 days of illness. With this, we could control SARS very well. Now, SARS is a coronavirus. COVID-19 is another coronavirus. MERS is another coronavirus. So if what we did for SARS and MERS worked well, it should technically work well for COVID-19. But guess what? It's completely different. We have about 76 to 79% similarity with SARS of 2003, but yet the behavior is completely different. For one, it could spread asymptomatically. That means before your symptoms, you could spread. And number two, you can have the disease, you can spread the symptoms, you can spread the virus, but yet you may never develop any fever, cough at all. You literally become the silent Trojan horse. And we do not know who that person was. And yet that person can cause an outbreak within a setting of a church or a large group setting. So this is really a remarkably successful virus, something which none of us could anticipate.
Certainly. And I think since then, there's been about close to 5 million cases so far, 4.7 million cases, confirmed cases around the world, with more than 300,000 deaths, right, reported. I deal mainly with patients with chronic diseases, diabetes, hypertension, obesity, and training them to change their lifestyle, especially their eating habits, to better control their conditions. But people with chronic conditions, they're not kanchong, because I can do it tomorrow, right? Because they don't do anything, right? Nothing will happen tomorrow. They do something, they don't see the results tomorrow. So that motivation, that the impetus to do something about their chronic conditions is not there. But right at the beginning of this pandemic, right, we knew already that people with underlying chronic conditions like diabetes and hypertension, they are at higher risk of developing the more severe form of the condition, right, of COVID-19 and suffering from complications. But that was at the beginning. But now, 4 million over cases later, right, have we learned, we as a medical community, have we learned more about the relationship between COVID-19 and such chronic conditions?
Yes and no. We do know that if you are older, when you're more than 60 years old, the risk goes up. We know that if you're obese, especially with a BMI, body mass index of more than 30, your risk of getting severe infection goes up. Now, if you have diabetes, chronic renal impairment, even cancer, any of these conditions will put you at a high risk of death. And of course, myocardial infarction, or what we call heart attacks. When you have when you're at heart attack risk, when you get this condition, you're more likely to suffer from it. Now, so you understand then that the virus is honestly a weakling. Okay, it is really an annoying. What's the word for it?
That's a bully.
It's a bully, yes.
It's a bully. It's a nice way to put it.
The virus is a bully.
Pick up the weak and the people who are already suffering from conditions and
spot on.
Yeah.
The virus is a real bully. It takes out the weaklings, the aged among us, those who are weak at the periphery of the society, and they take us off one at a time. But honestly, I would rather they pick me on someone who's an able fighter, or like yourself, for example, and then we'll fight this out.
Yep.
But no, there is a bully. It takes off the weak ones one at a time.
In fact, just now you mentioned about BMI above 30. Around the world that has been reported, but a recent study by a Singaporean team, right, highlighted that even with BMI in excess of just 25, right,
The risk is higher.
The risk is still higher. They will need
Yes.
oxygen. They may be more likely to go on ventilator. The need for more intervention, suffering from more complication is already going to be higher at BMI of above 25. Above 25 is not very high, Right?
No, it's not.
For many of us, we may be getting quite close to 25. Yeah.
I agree. You're spot on. And I've come up with a good analogy for that. For people who are obese,
Yep.
it is equivalent to someone sitting on them. So lie yourself flat on the floor against a hard surface. Then you get a 20 kilogram sack of rice and put it on your chest. That's the excess fat which you have on your body. And you try to breathe in and out while lying flat on the floor with the rice on top of you. You're going to have problems breathing. You're going to have problems coughing. When you can't breathe and cough well, your gunk or your phlegm will get stuck inside there, and in terms of pneumonia will worsen, and in thereafter you get bacterial infection that's growing, a superimposed infection, and the person gets worse. So BMI more than 25, you're at risk. BMI more than 30, you are really at risk. If you're thinking of a reason to lose weight, you're thinking of going for some high intensity activity to shed the extra kilogram, COVID-19, make it your reason to lose weight today.
Absolutely. When I deal with my patients and the people that I coach and train to change their lifestyle, their eating habits, especially in this pandemic, this COVID-19 pandemic, I've been encouraging them and also been highlighting to them, COVID-19 is not going away anytime soon. No, not when circuit breaker ends, and maybe even into the next year. All right. And in order for us to lower our risk, right, of developing a severe form or even dying from COVID-19, now more than ever, right, is the time to deal with those chronic conditions like weight issues, like diabetes control, hypertension now, right, through various forms, not just on medications, but also the lifestyle, the exercise, the eating habits, because recently I read a study from China, right? They studied a group of, I think a few thousand patients, and of which about 2,000 of them were diabetic. And they separated them into two groups, and one group of them had better glucose control, right, than the other group. Both are diabetic. And the group that had better control had a less severe form, had developed less complications. I mean, we take it as a given, right? We knew that it's likely to be the case, right? But certainly it helps, as doctors to have evidence of that, coming from studies around the world. So what would you say to diabetic? Because a lot of people have the wrong impression, right? That if I'm obese, right, if I have diabetes, if I have hypertension, I have other chronic diseases, right, what I need to do is really just lock myself up, don't go out and hope that I don't get the disease, right? But that's the first step. Right, but would you agree that the second step is really take this time to also improve the control of the condition, losing weight, getting better sugar control, getting better blood pressure control? Would you agree that that should be an important thing to do during this time?
Absolutely. You're really touching something that's very close to my heart. So I'm going to share with you. In fact, to those diabetics out there, I am a diabetic just like you. So I am taking medications, but I'm not letting diabetes rule my life. Instead, I am controlling diabetes. I'm controlling what I eat. I am controlling with the medications, and I'm leading an active lifestyle. I do have my exercise regimen so that I keep fit. I do not let diabetes control me, but I control it. Despite all this, I still have to take medications. But that's a fact of life. No one is born perfect and no one will die perfect. So we will all pick up a bit of illnesses here and there. It's not about us picking up illnesses. It's about us living and controlling the illness rather than letting the illness control us.
Be conquerors in spite of whatever conditions, whatever situations.
Spot on. Yep. So if you think about it, we always talk about immunity, we always talk about white cells, and for diabetics, the sugar which you have in your body, if it's high, the sugar to the white cells are like alcohol to soldiers.
Yep.
You have too much sugar, it's like lots of alcohol to your soldiers, and your soldiers won't work. So if you want to have a good and fighting fit soldiers inside your body, then you have to control the sugar. In fact, if your sugar is normal, you are going to have really a trim and mean fighting machine inside you. That is the best way for the rest of your life. That's the best way to fight infections like COVID-19 and even other infections, classic pneumonias from bacteria
Yep.
or influenzas. They will still affect our lives even though we don't have COVID-19. So do it now, not just for COVID-19, but for the rest of the other illnesses that comes. And
I
as
think
you
that's a very useful message that you have shared, Dr. Leong, not just for my patients, many of whom are diabetic, right, but also for everyone listening in, everyone watching this, sharing, right? And can I just ask you something that, because recently I've been speaking to different people from all around the world, right? And then of course, Singapore, I mean, we expect, we hope, we are praying, we're looking forward to life returning to pre-COVID-19 normalcy to some degree. And of course, this COVID-19 situation has brought to the fore, for us to review what is truly essential in life. All right. I think to Singaporeans, there are some essential things, somehow shopping, eating out, and traveling. All right. Let me just go through that quickly with you. Right. First is shopping. I've spoken to some friends from around the world, especially in the US. Right. When they receive parcels, right, from Amazon and all, they even go to extent or almost literally quarantining the parcel for 3-4 days before opening it. But we do not see that in Asia. We do not see that so much in Singapore, right? So what would you say to people out there when receiving parcels?
I'm not worried about the parcels. In fact, the amount of handling there is actually very, very minimal. Now, if you receive a parcel, what's important is that I will receive it, I will open it up. Thereafter, I wash my hands before I touch my face. Now, you must understand on the parcel, fair enough, there may be viruses, but more importantly, you may have other bacteria. I will handle the parcel, but I wash my hands thereafter. And this happens not just for parcels, for food. Whatever you receive, wash your hands thereafter, and you will be safe. I'm not worried about the parcels spreading COVID-19 as, number one, it doesn't really happen.
Yep.
It is extremely, extremely rare unless someone decided to sabotage you.
Yeah, to sneeze into it just before handing it to you. Yeah, but it's very, very interesting because it's almost an American thing that is very prevalent, right? But in Asia, the people I spoke to, and even in Singapore, it's not so, right? But what you shared is also very interesting in that COVID-19 is going to bring about a new normal. Some good things will come up from it, like better personal hygiene practices as a habit.
Yes.
Because it's not just because of COVID-19 that when we receive parcels, we should wash our hands, though, even after that. Right? It's a good practice to have. It's a good habit to have.
Yes.
So that would be a new normal. But let's go on to the next thing, which is the next essential thing that most Singaporeans think about as essential, which is eating out. All right. I just ask you in a very personal perspective. When do you think you would be sitting in a restaurant in Singapore eating out, and what restaurant would that be?
It will be very, very quite a few months later. I don't foresee that happening until the cases are consistently zero. And if anything, I will go for my Chinese dim sum.
Dim sum, yeah?
I'll go for my Chinese dim sum and I'll sit
The
down there
first
with my
sit-down
Chinese.
meal out there will be a Chinese dim sum, right? Let's
Yes.
hope that will happen sometime, as soon as possible, right?
What will yours be anyway?
There are there's few Chinese restaurants that are my favorites. My first go-to place, would be this Chinese vegetarian restaurant that I used to visit. Right, they serve very wholesome food that's not mock meats, and I love that place. I think that would be one of my first place to go, with my family. Right, hopefully we'll be able to do that in
Sooner than
2020.
later.
Sooner rather than later. But we should not be taking things for granted, should not be jumping the gun. right, in trying to resume normal life too quickly, because we have seen, right, all over the world,
Yes.
right, where they reopen, everybody kanchong, to rush out and think wrongly that life has gone back to normal, and then you see a spike in cases, and then they shut down again. I think it is a very important message we need to get out there to Singaporeans, to people around the world, not just Singapore, that when the restriction eases, I think we need to take it easy. You need to be chill. Let do it slowly. Would you like to reinforce that message as well?
I would. Now, time and again, every epidemic there will always be the first wave. After the first wave, you will have the second wave and the third wave. The second wave may come because of the colder season. So we are certainly anticipating that in November, December, when the Northern Hemisphere goes into the winter season. Or the second wave may also come when the controls were not adequate at the first time, and then the controls were lifted. And we saw that happening in Korea. Korea was amazing. When they lifted it, one person went to 5 night spots, and then
became a super spreader.
Yes, more than 119 people became infected thereafter. Now, when the controls were lifted in Germany, a place that had very good control of COVID-19, the abattoirs started having cases. The same thing for Australia. So, unfortunately, I'm going to say this. Watch my words. When America lifts its controls, even though it's going into the summer months, we're going to see tiny waves come up again. Now, we would anticipate a new norm. The new norm would be control, relax, control, relax, control, relax. So either we go into this repeated waves, or two, we have to take on a new normal where distancing is preferred. I like 2 meters more than 1 meter. Everyone keeps their distance except within your own household. No large social gatherings. Everywhere you go, you will actually wear a surgical mask, and you'll keep your hands clean with alcohol rubs, or even if you have to touch something, forbid your hands from touching your face until you have them cleaned. We're going to have a lot more of these Zoom meetings. I personally like it because we travel less. In fact, do you realize that you're actually saving time where we could just
you can do a lot more. You can do a lot more. And reconnect with people a lot more than before. It doesn't mean that we're not going to meet in person and go to la kopi, going to eat together, have a drink, have happy hours. We're going to do that. But right now, because of COVID-19, I think we are going to have virtual meeting on top of, even after COVID-19. I think that's a wonderful thing.
And you might have read about the otters that have come out and they've invaded into KK's compound.
They're having a buffet, They're having a buffet, They are helping themselves to all the fishes in all the different ponds that they can get themselves into. Right.
I like the clear skies coming back. I like nature taking back in control. I think in a way it's a good. The silver lining for these dark clouds is that the nature is taking back into control, and we must learn to respect nature more after this event. We shouldn't go back to status quo, but things have to change, less energy consumption, and actually more concern for nature.
And like you said, we learn from history, but we should also prepare for the future. So this COVID-19 will not be the last pandemic the world will experience, right? And certainly, as we have learned from the Spanish flu, learned from SARS, learned from whatever that we have hit us before. And we hope that through this COVID-19 pandemic and the new norms that will happen, they will put us in better state to be prepared for the next pandemic. We hope it won't happen in our lifetime, but at some point in history, it will still happen. Right?
Absolutely.
It's likely to come. Yeah.
So after SARS, I predicted there's going to be NAS, BARS, WAS, WAS, and whatever. And then now with COVID-19, it's going to be another vid in another year. In fact, in March 2019, there was a scientific paper which actually predicted and said there will be another outbreak of coronavirus coming from China. That's because they realized that the virus that was that infected the rest of the world came from coronaviruses that were found in bat caves in somewhere near Yunnan. So unfortunately, as man eats more and more of these animals and
Exotic stuff. Yep.
invade into this animal kingdom, we're going to see more and more of these cases. We need to make changes in our lives. The earlier we see them and control them, the faster we're going to get rid of all these epidemics.
One last question before we go, because we need to cover,
Yes.
all the three essentials of Singaporeans' life and expectation, right? What do you miss the most? But when it comes to travel, right, where would be the first place that you would travel to, right?
I'm really
once this COVID-19 make you feel safe enough, improve enough to make you safe enough to travel, where would you travel to? And when do you think that will happen?
Actually, I was really looking forward to going to Japan at the end of the year. In fact, in January and February, I was still checking if I was to make a booking, would they still accept it? And what happens if I could cancel it? There's a good thing is that I didn't make any deposit or any booking because I don't think Japan is a visibility at the end of the year. I think this is going to drag on. At the earliest, I could look forward to 2021 to 2022 winter season before I can go Japan again. I would love Japan for the scenery, the food, the people. I think it's a fabulous country.
Yeah, good. I think for me, my next trip, once we feel safe enough to travel, maybe we'll be to Korea. We as a family, we love Korea. We love Korean food. My children love Korea, and we miss Korea. All right. So our first trip for you will be Japan. We will be nearby. And I'll be traveling to. And like you, right? I do not think that will happen in 2020. Hopefully in 2021. Or maybe even 20. Yeah, keep your fingers crossed.
Fingers crossed.
In order for that to happen, you in this fight, and all of us, the medical community, everybody, the whole Singapore, the whole global community, we have a chance still, to beat COVID-19, back to where it came from, to beat it into submission, for us to conquer it earlier rather than later. Right? I think it is useful for us to just tell everybody, even though the situation is bad, let's not give up, but let's continue to practice social distancing, to be able to bring the transmission rate to as low as possible, right? And to be able to finally, conquer this very, very, very disruptive pandemic.
Absolutely. So eventually, it boils down to not my effort alone or your effort alone, but the effort of everyone in the country, the effort of everyone in the world, from the commoner right down to the pedestrian person, right down to the scientists, and even the politicians. If all of us work together with the same mind, with the same vision, with the same mission, we will get rid of COVID-19 and we can win this war. We certainly can.
I certainly believe so, agree with you. It's not going to be easy. The odds are stacked against us, right? But we must do it, right? We have no choice, and I believe we can. So thank you very much, Dr. Leong, for coming onto the show, right? It has been great, your sharing. I wish you all the best, that your trip, your dream trip, right, to Japan will happen sooner rather than later, and you'll be having dim sum, in your favorite restaurant sometime soon, right, in a few months' time. Yeah, so all the best. Take care. Stay safe.
Thank you.
And thank you.
Thank you.
Thank you.
Bye.
Bye.